News that impacts you and your community. 13 on Your Side Evening News starts now.
And we begin at 5:30 with the United States House of Representatives preparing to vote on the Senate's version of President Trump's spending bill.
Healthcare providers are bracing for potential impacts, including our state hospitals that provide care to thousands insured by Medicaid.
13 on Your Side's Lauren Baker spoke with one Michigan hospital leader about the impact of cuts to Medicaid in our state. Lauren.
Yeah, Elena and Julia, Executive Vice President of the Michigan Health and Hospital Association, Laura Oppel, says 1 in 4 Michiganders uses Medicaid to cover their medical care. If the proposed cuts to Medicaid are approved, the impact will hit every hospital, but especially those in rural areas. Michigan hospitals are bracing for the potential Medicaid cuts at the federal level.
It's just hugely disappointing that this is the way the Congress is reacting to some of the economic changes that they'd like to make.
Executive Vice President of the Michigan Health and Hospital Association, Laura Oppel, broke down the potential impacts President Trump's agenda bill could have if the proposed $880 billion in Medicaid cuts are approved. For Michigan hospitals, the funding loss is in the billions.
From the time that this bill takes effect for the 10 years going forward, the hit to Michigan hospitals is over $6 billion.
She says 25% of Michiganders use Medicaid to cover things like labor and delivery. And in the example of labor and delivery, Medicaid covers more than 50% of births at most hospitals. A funding loss there could cut services altogether.
Labor and delivery is very expensive. You need 3 physicians usually to cover that work, and that doesn't necessarily include midwives and other nurses. So it's entirely possible that a hospital will find it difficult to keep that labor and delivery service going.
And those cuts could trickle down to rural hospitals that don't have as much financial security. That's because some rural hospitals can be more expensive to keep open.
Sometimes the cost of running a rural hospital can be higher because in order to attract physicians and other clinicians and experts, you might actually have to pay more to get them to come to a rural area for work.
And if a hospital can't get the funding it needs, it could close, forcing patients to drive even farther for their care. But Oppel says now is not the time to panic. Because the cuts will happen over a period of time, she and other healthcare leaders will work to find funding needed to provide service.
Hospitals are in the business of taking care of people and saving lives, and they're going to keep doing that regardless of what happens next.
And Oppel wants to remind people that the impact doesn't just stop here. Other health issues like providing insulin to diabetic patients or healthy food options to children will be greatly impacted. In the newsroom, Lauren Baker, 13 on Your Side.